But we do have a question from Nora that came in just a little bit earlier. I have a hard time taking the stairs with venous insufficiency. Would exercise help with CVI?
Okay, that's a good question. The only thing I want to understand if it's a deep venous insufficiency or instead the superficial venous insufficiency. It makes a big difference.
She
Is it
didn't
the saphenous
specify.
vein?
She didn't specify. So would you mind just giving us the
Okay.
difference?
Sure, yeah, definitely. So essentially, there are two different systems in the legs. I'm talking about veins. So there's the superficial system and the deep system. The superficial system is the one that really doesn't really doesn't have a big importance because it's the one which anyway drains into the deep one. So essentially, the veins can be burnt, they can be cut, they can be removed, and actually you have no impairment of the venous circuit. So it's important to differentiate this, which can be treated surgically or with like avulsion of veins. So you remove the veins or you cut the veins, or with endovascular techniques, burning the vein from inside, compared to the deep venous insufficiency. Deep venous insufficiency, unfortunately, is the one that usually people have swollen legs. And I think that the case that you mentioned before, Kim, of our patient is a superficial venous disease. But anyway, the deep venous disease has no real cure because with a superficial one, together with also removing the veins and cutting the veins and blah, 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 you can also use compression stockings, which are stockings which are pushing the superficial veins to squeeze the blood into the deep venous system. So the typical question of people who undergo any kind of superficial venous surgery or treatment and say, oh, doctor, you're closing my vein. Oh, doctor, you're removing my vein. Does it mean that the blood flow won't circulate anymore? No, because that's the deep system. But if the deep system is affected, then it's like a bit more tricky because the only thing you need to have postural therapy, but there's not really anything you can do for that. The thing is like what insufficiency means. Insufficiency means that, the veins, in order to bring blood flow from the toes to the heart, have valves. Because, the vein flow is going against gravity with low pressure because the heart pushes the blood flow into the arteries, but, the pressure in the vein is very low. So what the body developed, it's like you have valves, and these valves are one-way direction. So the blood flow is pumped up, goes up like in a lift, and then the valves close. And every time there's a pumping, the blood flow goes up like on a stair, and it doesn't come down. But if you have insufficiency, which means that the valves in the veins don't work anymore, that means that the blood, instead of going up and staying, goes a bit up and down because all these valves are floppy and they don't keep this kind of mechanism for the blood to come up. So that means that the blood will stay where it is. It will feel heavy on your legs, and it will possibly cause varices because all the veins are getting pressurized because there's no good outflow from the superficial venous system, and they get this kind of varices, which are not like life-threatening, but it can be annoying.
Thank you. That was the best explanation ever that I've heard on that.